Many have dreamed of having LASIK, but it's never become a reality. Well, now it can. Dr. Petit of Newsom Eye is here to discuss why now is the time. Doctor, how are you?
Fantastic. How are you doing?
I am well. Glad you came in today, and I'm glad to talk about LASIK because it seems like it's one of those terms out there that you've heard people talk about, but might not necessarily understand how the procedure works and if they're a right candidate. So first, explain what it is.
Well, LASIK is recurving the cornea or the front part of the eye or the dome of the eye in order to see clearly, and we're just redirecting the light in order for patients to not be dependent on glasses or contacts.
So I know it used to be a big thing, like if you were a candidate or if you were not a candidate. How has that changed? What would you tell people if they've heard in the past, oh no, you're not a good candidate?
And that's a very good question, because at the beginning we had a very narrow parameter that we could work with. Now the lasers have greatly increased, and Dr. Newsom has made sure that he stayed on top of all the technology. We can do much higher prescriptions. We can do people who have astigmatism, which we could not do at the beginning, and people who are also farsighted. So now there's a huge parameter that we can now fit patients and treat them.
Why is that? Why have we seen a change that you're able to treat more people?
We learn. And the technology has definitely advanced, and it's created much better outcomes.
So even if a person has been told before in the past from other doctors, like, no, you're not a candidate, they shouldn't let that deter them from giving you a call.
What I tell those patients is definitely come in. We always offer a free screening. Come in, let us take a look and see if you are a candidate.
So you always hear, oh yeah, you go, you get the procedure done, you wear the glasses for a while, and you're good to go. I mean, is that true? Say people do have some, are a little concerned about, having a surgical procedure done on their eye. What would you tell people there?
Yes, it is surgery to the eye, so you always have to take it seriously. And we always make sure that the process is very simple and straightforward. Our job is to make sure that you are a great candidate. Everything is going to run smoothly from beginning to end.
And what about the downtime that people may face afterwards?
There is no downtime. With LASIK, pretty much you're good to go the next day.
Ooh, you can't argue with those odds. Well, so if you have the surgery, you're good to go the next day. You can see, cause for celebration. No more eye doctor appointments, right?
Wrong. Good try. Now, you still have to have your annual eye exams. Obviously, we want to make sure that the surgery is stable and is successful. But the eye is the only part of the body that we can actually view the vascular system. So we're not just looking at, can you see well? We're looking at, okay, do you have high blood pressure? Do you have diabetes? Do you have cholesterol issues? And we can view the retinal system directly inside the eye. And that will give us a clue. Are we having problems or are we not having problems? Because you just had this surgery, you want to make sure that we're seeing clearly for the lifetime of the patient.
Okay, so again, if people have any kind of hesitation about giving you a call, you're saying no. If you thought about LASIK, now's the time to call.
Now's the time to do it. Dr. Newsom has some amazing outcomes that we have seen, and we've also kept up with the technology. So we always have the latest technologies for our patients.
Good stuff. Well, if you're interested in getting more information from Dr. Newsom, well, there's the information on your screen, website, phone number, address, all the good stuff's there. Dr. Petit, thank you so much for coming in and talking about this today.